everyone think that psychiatric nurses or mental health nurses doesn't do anything. Like, that is so annoying.
You need to know you're beautiful, you're perfect just like you are.
Hey guys, welcome to my channel. I'm Georgia. If you're new, welcome, and if you're not, welcome back. In today's video, I'm going to be talking about 5 pros that are beneficial for being a psychiatric nurse. But before we get started, make sure you guys like this video, share the video, subscribe, and also leave a comment down below. So for number 1 would have to be communication skill. Communication skill is very important in psychiatric and mental health patients because they are going through a challenging situation, and with communication skill, you want to be compassionate and sensitive towards your patient, and by having a good communication you can de-escalate problems even quicker. You have to learn how to put yourself in that patient's shoes, being sympathetic, and that will teach you how to be empathetic towards your patient, and doing so that will become like a norm to you as a nurse. So you will also be empathetic to other people outside of your working environment. So communication skill is like one of the biggest pros in psychiatric nursing, that you need to know how to talk to each patient, because the way how you talk to a patient that is SI, which is have suicidal ideation, is different from a patient that is HI, which is homicidal ideation, where they want to hurt others. It's different from talking to a patient that have depression or have anxiety. So you gotta learn therapeutic communication skills, where you develop compassion with your patient. You gotta learn how to be sympathetic and to be empathetic. So learning how to put yourself in the patient's shoes, like thinking about how, if your family member have that disease, or your family member or you yourself have that disease process, how would you want someone else to talk to you? And talking therapeutically, it doesn't necessarily mean just verbally. You have to learn how to talk to patients, verbal communication and non-verbal communication, because if you go into a room talking to a patient, your head is down, your shoulders like this, the patient is going to think that you are not interested. If you go into a room with your hands folded like this, the patient might become defensive, and they start getting agitated and want to fight, and you're wondering why. But sometimes your verbal communication is just as important as your non-verbal communication. The next thing would have to be the pay. So you know that the pay in psychiatric nursing, it's very competitive because the demand for psychiatric nursing is so high. You have so little nurses that want to go in psychiatric nursing, and the nurses that do go into psychiatric nursing, you'll find that they get a little bit more pay than nurses that does not specialize in psychiatric, or they choose a different specialties. The other pro in psychiatric nursing, number 3, is that you get to work with so many different populations, because in psychiatric nursing you have children that have psychiatric disorder, from eating disorder, suicidal thoughts, they have abandonment issues, and so on and so forth. Then you have adolescents and older adults in psychiatric, so you get to work with all different population in psychiatric nursing, whereas if you go in other specialty, sometimes it's only working with one specific population. So the fourth thing would have to be your working hours, or the places that you get to work. So with psychiatric nursing, some places you can work 12-hour shift. You can also work inpatient and outpatient, where sometimes you can work 8 hours, 10 hours. So you can find jobs that are like a wide variety of hours that is good. Okay, you can work with a variety of patients from different ranges. So you can work with children, adolescents, and you can work with older adults. And if you do not like to work with children, you can work with adolescents. If you do not like to work with adolescents, you can work with adults, and you can still become a psychiatric nurse. For example, if you are a med-surg nurse, most of the time you work with older adults or in their mid-age, but for instance, you don't like to work with mid-age people, but you want to become a psychiatric nurse, you do have the option to work with children, and you have the option to work with adolescents and adults. And then you have so much different places where you can work as a psychiatric nurse. You can work in prisons, you can work in home health, you can work in hospitals, you can work in nursing homes. There's so much different places that you can work. Outpatient clinic, you can be a case manager for psychiatric nursing. There's so much things. So one of the cons for psychiatric nursing is that everyone think that psychiatric nurses or mental health nurses doesn't do anything. Like, that is so annoying. Like, I hate that. They believe mental health nurses don't do anything. They just sit there and babysit. Like, okay. We go through so much things, like how mental health nurses or psychiatric nurses, maybe they don't work physically, but they do a lot of mental work. Like, they have to use their brains constantly to intervene with patient situations, stuff like that. You have to be able to be a critical thinker, and there is so much things that we do as psychiatric nurses that other nurses can never dream of doing. Because right now, if I put a psychiatric patient in a medical hospital, they would not know how to treat that patient. They would just start giving that patient medication upon medication, and they'll start putting the patient on restraints, and just they do not know how to handle psychiatric patients. So leave medical where medical is and psychiatric where psychiatric is, because we are two different calibers, okay? But that is one of my, like, I hate that everyone believes psychiatric nurses do not do anything. We're like, things that we do, medical nurses do not do that. And then things that medical nurses do, we can learn that in like 5 seconds, like putting in an IV, like 5 minutes, and you get that. But knowing how to talk to patient, knowing how to de-escalate in situations, that take years to learn. You cannot just get somebody or just get a nurse and put them in psychiatric nursing and think that yes, that person is going to have good communication skill, and they're going to be this, and they, like, if you put a med-surg nurse or if you put a pediatric nurse in a psych facility, they will go crazy because they do not know how to deal with the patients. Vice versa, if you put a psych nurse in a med-surg floor, maybe she don't know how to put in an IV properly because she doesn't have to do that, you know. but just teaching her how to put in an IV for maybe 1 or 2 times, she'll get it. But you can't have a med surg, or you cannot have a pediatric nurse come to psych and teach her how to communicate with patients. That is not, you cannot teach someone how to communicate with patients. The next thing that get me so upset is when they tell you, oh, if you choose psych, you're gonna go crazy, you're gonna act just like your patients. Like, really? Most of the times, if you have an underlying issue, yes, you maybe have that. You will go crazy because it's not for the regular person. You know, it's not for the regular person. But yeah, that's what I wanted to say. But yeah, I just hate when they tell you, oh, psychiatric nurses don't do anything. All they do is sit there and babysit, and then all they do is just watch the patient and give medications. Okay, if there is things that come up, we have to do them, but maybe it's not we don't have to do them all the time, because if you have an IV, like, that is a risk for SI. You cannot put an IV, have auditory hallucinations, or, you know, like, come on, hallucinations. You cannot have towels and cards just sitting there. They will commit suicide. But yeah, I hate when other nurses do like that. Oh, you're gonna lose all your skills if you become a psych nurse. No, I'm not going to lose all my skills. Maybe I'm not gonna use them, but I can learn them in a 2 or 3 days. Yeah, in nursing school they don't teach you how to they show you how to put an IV on a mannequin. They don't show you how to put the IV on a real person. So you still have to learn, you know. But let me stop venting. Guys, do you like my hair? I got a perm. Looks so nice, right? I'm joking. I didn't get a perm. This is a wig. It looks so nice. I really like it. But if you do want to become a psychiatric nurse, do not let anyone stop you from being a psych nurse, because at the end of the day, it is you that have to be in control of your future. If you listen to everyone, at the end of the day, they are going to tell you you shouldn't have listened to them. You should have do what you think that is best for you. So do not listen to anyone. If you want to become a mental health nurse, if you want to become a psychiatric nurse or a behavioral health nurse, it's kind of the same thing. But if you want to become a psych nurse, be a psych nurse. If you want to become the president of America, you can work towards it. Yes. Like, you can be whatever. If you can dream it, you can achieve it. Okay? So don't let nobody try to step on your dreams. Do not let anyone tell you, oh, why you want to become a psychiatric nurse. You're not gonna learn anything. You're going to lose all your skills. They don't do anything. They're lazy nurse. Like, okay, that's your opinion. Have you ever